a discussion on race and medicine.
Hey, socialites. This is the Socialite PT, Dr. Lola Adeyeye, tuning in, and I have a special guest with me, a really good friend of mine, Dr. Evelyn Ashiofu. Welcome.
Oh.
So, Dr. Evelyn is doing so many wonderful things in medicine right now, in public health, in helping break down racial barriers in medicine. And we just want to get a little bit more information about what she's doing, major moves, things she's experienced, and just have a better idea, especially what's going on right now in your side of health profession with so much going on in the race and society and everything else that's currently happening in this crazy time. So, Dr. Evelyn, how about you introduce yourself a little bit, tell everyone about the great things you're doing right now, and just some of your background, educational info.
Sure. So I was born and raised in Houston, Texas, in Southwest A-Leaf, to be specific. And graduated high school, went on to college at UT Austin, and there I got my bachelor's degree in public health. Yes, Huckam Horns. um, I so graduated there. Went to medical school in San Antonio, the UT School of Medicine in San Antonio. And actually, when I was there, I did a dual degree program. So I got my MD, and at the same time was getting my master's in public health degree from the UT School of Public Health as well. So graduated in 2017 with both of those degrees, and then moved to Dallas, where I'm doing currently in my psychiatry residency. And yes, and I am a third-year resident. Actually, will be a fourth-year resident next week, which is very exciting.
Congrats.
Thank you. Very excited about that. And hopefully wanting to do a child fellowship, so like a pediatric psychiatry fellowship. God willing, will start in July of 2021. And so I'm looking forward to that. And so that's kind of like the journey I guess I've taken to where I'm at now professionally, and my career interests are really working with transitional aged youth, so patients that are about 15, 16 to 32, 33 years old. So I really am interested in that population in particular. And also a lot of diversity and inclusion work. So those
Yes.
are I am most interested in career-wise. So.
Okay, well, let's talk about Black excellence, because Dr. Ev is very, honest and humble, but tell us a little bit about an award you got not too long ago.
Yeah, so I'm really, really quite, I feel really honored and blessed to have been chosen as an American Psychiatric Association Diversity Leadership Fellow. And so basically, the American Psychiatric Association, which is for short APA, is like the biggest governing, professional governing body for psychiatry in the country. And every year they pick a couple of residents across the country to do these fellowships. And the one that I got, the Diversity Leadership Fellowship, is basically given to someone who they feel is going to be a trailblazer and a leader in the field of psychiatry as it pertains to, for me, diversity. And so I'm really excited about that. I get to go to these cool meetings and get to meet a lot of cool people who are doing similar things, such as the current president of the AMA, the American Medical Association.
Oh, wow.
She's African American psychiatrist. So like meeting someone like that, or getting to just converse with someone who's the leader of the biggest medical governing body in the country. Like, so just things like that, meeting cool people, networking, and then getting to create my own projects, things that I'm passionate about, and getting that support from them both like just mentoring wise, but then also financially, you know, because sometimes you need money to get stuff done. And so just having that support is really cool. So that's something that I got awarded not too long ago. So I'm really excited about that.
Wow, so you really had a span in medicine, experienced medical school, almost done completing your residency and entering your fellowship. And through that, especially with your interest in diversity and making sure the field has more of a different kind of face that you typically see, what are some of your experiences as a Black female doctor, especially in a specialty that you don't see that often? There's a certain stigma with just mental health and the Black community. So you really stepping out and saying, hey, I want to make a difference in this area. What has been your experience? And even deciding that this is the route you want to take?
Yeah, so, you know, it definitely hasn't been an easy experience by any means. I mean, I think I can, you know, I can't speak for every Black health professional in the world, but I can definitely bet that there's more people than not that have experienced their fair share of naysayers, haters.
Always got them.
And that's not, and that's no difference with me. You know, I definitely, growing up and getting to college, I definitely heard, just doubts about, if medical school was the right route for me, if I might want to consider doing something else instead, or maybe waiting to apply.
Yeah.
I even from people like peers, who are, non-Black peers who, when I do get into med school, say things like, I only got in because I was Black. I've heard that before.
Wow.
Yeah. And so it definitely, it can definitely take a toll on you. And I mean, I've definitely internalized things, comments like that. And I think that's where the development of imposter syndrome really comes into play, where you really start to wonder if you belong or if you deserve to be at the place that you're at. And so I've struggled with that. I still struggle with that even now. Just having to mentally check myself and tell myself like, hey, you're doing great. You belong here. Like don't beat yourself up about things. But certainly being African American in a field where there's not many, so it can definitely cause some anxieties and some fears, and so I've definitely experienced that. And then like wanting to make sure you have people that you can look up to, and finding people.
Mentorship,
exactly. That's another thing, that when you're not seeing a lot of people like you can sometimes be disheartening and a little isolating as well. But then there's like the flip side, right? So there's all the struggles that I've endured on this journey to where I'm at. But it almost is all, or not even almost, it makes it really worth it when I do see another Black patient and their eyes light up and they're just so happy that there's someone who looks like them, who can relate to them, who they can talk to and who they feel comfortable with. And it's almost like, this is it. This is why we need people that look like us in these spaces.
Exactly.
Because we need someone who's advocating for our patients. And so I'm happy, that I'm getting to be someone in that role. So.
Yeah, well, I just want to say thank you for stepping out, doing something different, really being that face and that voice in those areas. I can definitely relate just in regards to, especially what you just said about patients feeling comfortable, and physical therapy. It's a lot of like hands-on and, being really close to patients and talking to them like 2 to 3 times a week. So, sometimes patients, I'm sure that you've also experienced, will withhold information, not want to share what's really going on, or even sometimes medical history because they don't want to be judged or they don't feel comfortable, just period. So I yeah, I definitely agree. I think that's really important to see, you know, not just a certain population, but more Black health professionals all across the spectrum, just, you know, showing that, hey, like we're out here and we're doing it and, and, and doing it well, okay? Very well. So yeah, so that's very important. Yeah, with that being said, what are some of the major health disparities that you've experienced or you've seen in your role in medicine?
Yeah. So, you know, as a psychiatrist, you know, the population I work with is obviously those who have been, are struggling or dealing with the mental health disease. So be it depression, anxiety, bipolar disorder, schizophrenia, substance use disorders. And there's quite a bit of health disparities that are by race and health inequities that we see. And for me personally in my field, one of the biggest things is access. And so we know that, I mean, there's only a third of African Americans who have been diagnosed with any sort of mental illness who are actually getting treatment for their mental illness. Compared to the rest of the population. We see that there's a disproportionate amount of African American youth who are attempting suicide, dealing with depression, dealing with anxiety, and this is a significant higher rate than their white counterparts. You know, so that's a big health disparity that we're starting to see come out. Substance use disorders, we're seeing African Americans disproportionately going to the criminal system for substance use disorders when they should be diverting and getting into more substance use rehab programs, you know, compared to their white counterparts. We see an overdiagnosis of more severe mental illness in African American men than compared to their white counterparts, such as schizophrenia. People are being diagnosed with schizophrenia at higher rates than their white counterparts, even if they're presenting with the same or similar symptoms. And so there's you know, the list goes on, you know, of what we're seeing, and we also know that mental health is definitely not a single factor sort of diagnosis. It's very multifactorial. There's a lot of things that influence the development of mental health disorders, including, you know, societal things, so poverty and education, unemployment, things, a lot of what we call the social determinants of mental health. So these are things that are influencing a person's propensity to develop a mental illness. And so when you put all of those things together and you look at the inequities that already exist for African Americans, it's not terribly surprising that we see this huge disparity when it comes to mental health as well, because it's the same African American population that are dealing with these really horrible systemic social issues. And so we're also seeing that reflect in the mental health world as well. And so those are some of the major ones. I think treatment is a big one, because it's like, you know, we can really make a difference if there is just access. You know, if we could increase access to our services for African Americans, but yeah, it's something that we're still trying to work on.
Yeah, no, definitely. I'm glad that you broke it down into those different categories, because you're right. I feel like when people mention mental health or, oh, I'm seeing a psychologist, you just come to mind like certain things. But when you broke that down to the schizophrenia, like substance abuse, I feel like sometimes people don't really even put that into mental health as well. So thanks for sharing that aspect of it. Yeah, and just in regards to speaking about mental health and just what other Black people are experiencing right now, just noticing, not even just noticing, the world is just noticing, but more awareness being brought forth about the different deaths, injustice that's been happening lately, and just what Black people in general are experiencing. especially with the death of George Floyd and what that caused a lot of people to feel as well. That's just one name out of a bucket of names, you know. What are some of your personal experiences when you saw, if you watched the video? I couldn't watch the whole video. I've seen enough videos, so I couldn't watch the whole video. But what are some things that you experienced personally when you heard about another death of a Black man, or saw that video?
I also cannot watch the video and did not watch the video to preserve my own mental well-being. But I'll tell you, I took it very hard. It's hard to watch someone who looks like you, or could have been anyone that be senselessly killed at the hand of police, and it's almost like happening on a consistent basis. There's only so much you can take, and so I had a mixture of emotions when I heard about George Floyd and Breonna Taylor, like just anger and despair and sadness and frustration, and also like hopelessness and helplessness. It just kind of feel like we're on a ride that's not stopping, and you can't get off, and you want to get off, but it's just like, here we go again, and the cycle continues. And so I had a lot of mixed emotions, mostly negative about what's been going on, and almost feeling like, are things ever going to change in this country when it comes to the treatment of Black people?
Yeah, no, I completely relate. I think personally, I felt very numb, numb to my emotions, numb to, like, literally what you said, like, wow, like, is anything ever going to change? Like, wasn't there just another headline the week before, if not the 2 weeks before that? And it's just like, wow, when will, justice really be served for these injustices, And so I feel like it makes it even harder being in environments where you don't see people who look like you, and these things are going on around you in the world, and you're looking around. I remember I talked to a few friends just in regards to, like, I literally feel like I'm in a workplace and I have to put on a face. It's like no one else is experiencing what I'm feeling, and I have to hold on to this face until that 5-6 p.m. where I get out of here, And so it really, I feel like personally, it really does have an effect on your mental, and it really does, you do have to create a safe space for your health to figure out how are you going to cope with this situation, another situation, and how are you going to let it affect your day-to-day, and also what are you going to do to help create some kind of change, in which is what you did. You went forth, and you really made a big impact in Dallas with your peaceful protests that you did. So can you tell us a little bit about how that even started? Like, what was the discussion like that led you and your colleagues to say, like, hey, let's take a stand, let's march for this?
Yeah, so, I definitely agree with you. I think, whenever things like this happen, it takes a big toll on your mental well-being. And I think for me, it did. And I, took some time to process what I was feeling, because you do have to go to work, and you do have to put on a face, and you do have to, in our field, I'm struggling with my own pain and my own hurt, but literally my job is to listen to other people's pain and their hurt. And so it's kind of figuring out how to do that, how to still be present and there for my patients who are depending on me, but also processing the things that I'm also dealing with. And so I think it's important. And what I did is to just make sure you do create that space and that time to process what's going on. So then as I'm processing, I'm also a type of person who likes to take action even in the times where I feel helpless or hopeless, like I was feeling. And and wondering how I can use my platform that I have to make a difference. And thankfully, there are people who are in my program, other residents that are in my program who feel similarly, who also want to use their platform to make a difference. And there is an organization that is called White Coats for Black Lives. And so this was an organization that I believe was founded in maybe like 2015, 2014, or sometime around that time. But obviously around the time that we started to see, like Trayvon Martin, Freddie Gray, like I don't want to say the beginning, because obviously this has been happening for a long time. But I guess the spark of seeing these killings on camera and the social media, like I kind of feel it's really sad to say, but there was like an era of when this all started to come to light where social media was also on the rise. And so earlier on when these things were happening, that organization was created. And I remember being in medical school and partaking in a protest on campus, White Coats for Black Lives, and making posters and doing a die-in and feeling like, we are using our platform to say, hey, this is a public health issue. Now, I have a background in public health. This is not just an individualistic type of issue. Like, this is not just like a person-to-person thing. This is like a population issue. This is a healthcare issue. And if we as health professionals don't like take a stand and let it be known that this is how we feel about it, I don't think we're doing our due diligence on this issue. And so I just, remember doing that in medical school and feeling very happy that avenue to impact some sort of change existed. And so we're just like, hey, I think this is the time to do it again. I think this is a better time than ever to show the world, show our program, show Dallas, show Texas, show the whole world that we as health professionals, we don't condone systemic racism. It's literally a public health crisis. It's affecting the health of Black people. It's killing Black people, literally. And it needs to stop. And so that's sort of how it happened, and that happened in one of these processing spaces where we're just all talking, and I just was like, let's do it. And
yes, initiative.
And then from then it was like a wildfire. We just got it started, and yeah, it was great. It was a great way to start off.
Was it difficult getting the word out? What did y'all use? Did y'all use like social media, or was it like word of mouth, or what kind of platform did y'all use?
So we really wanted to limit the amount of institutional involvement, because we were worried that if we tried to go through our respective programs that we would get a lot of pushback.
Yeah.
Because there's a lot of like red tape and stuff like that, but every program might not want you to say something radical on behalf of the program. Even though saying that you want people to stop killing Black people is not a radical statement.
Yeah, I feel like it's pretty moderate,
Yeah. I mean, hey, I think that's fair, but but to avoid anybody trying to shut us down, we really limited the having any sort of involvement from the institutions, and so we kept it word of mouth. We started off with just reaching out to our own residents, like our own program. We made a group me because that would be the easiest way to do things, and so not to like send anything through our public emails or our work emails. I'm sorry. And yeah, so just kind of like, hey, we're doing this on this day at this time. Do you want to join the group meet? Okay, cool. Whoever add them. And so that literally was kind of like a chain reaction. And so one person would get added, they would add 3 people, those 3 people would each add 3 people. And it was just kind of growing in that way, to the point that on the group meet, we had like 350 people in like 2.5 days on the group meet.
Isn't it crazy, the power of social media?
It's very, very powerful. Absolutely.
Like, What?
Yeah.
I can even imagine before like Instagram or even Facebook, like email I don't even know if that many people would have been reached. That's really good.
At least not in the time frame. You know what I'm saying?
Yeah.
Maybe people could have been reached, but definitely not as quick as it happened at all. Like, I mean, I kid you not, like 2 days we were already like at that number, over pushing 300. And so
Uh-huh.
it was amazing how fast that the information spread.
So like how did the day go? Did it, any event, there's known to be bumps, but how did the day go? Was it smooth? Did you run into any obstacles, anti-protesters, or was everything pretty good for the day?
For the most part, everything was pretty good. I think one of the biggest concerns or maybe challenges, is the fact that we're also, while we're fighting a social racial pandemic, we're also in a global pandemic, right?
Yes.
And so trying to pull off doing something where many people are going to be gathered, and we're health professionals, obviously, and so we're wanting to set a good example during COVID. I think that was probably a big concern. But I mean, we mandated masks. We picked a space where we knew that we were going to be able to effectively socially distance ourselves. And so I think that might have been the only sort of hiccup. Is like, okay, how do we make sure that everyone is wearing their mask and everyone's socially distant, so that we so that we set a good example, and we don't and we follow the guidelines that have been already set forth by like stuff like that. And I think that was well received. I think we did a good job of that. I don't know anyone who came there without wearing a mask, and like I said, we made sure to pick a space where we could effectively distance ourselves from each other. So
Yeah, no, from the images, from the news images, and then also the pictures that you sent out on your social media, it looked like it was a great event. You had many people. It looked like not only that, but it looked very diverse in itself too. So that was really good. So I would say overall, from what I saw probably with everybody else, it looked like, y'all did that.
Thank you. No, I'm very pleased with how it turned out. Like I, was thinking like, I want this to be a protest, absolutely, but I also want the aspect of having people come up and speak about their own personal experiences, racism. I think that was the twist that just made it, so powerful, is that we had our own coming up and talking about what they've dealt with and what they've gone through. And that's something that I think really took it over the top. And I got a lot of great feedback about adding that part into the protest, having that space to talk about that stuff. And so, yeah, and doing the dying, I think, is another aspect of it. I know a lot of people are for protesting, we're kneeling, and I think there's something to be said about laying on the ground. And it's really hot in Dallas, I should mention. So
yes.
I think so it was hot that day. And but I think there's something to be said about laying on the ground for 8 minutes and 46 seconds and almost getting a sense of what only just a fraction of what it could have been like to be George Floyd laying on the ground, but with someone, forcing him on the ground and having his knee on the ground. It was just so, it was just so, it just, I don't know, it just felt very impactful. It felt very emotional to do that, and to really feel that and sit in that. And so doing the die-in, I think was also a really great twist to all of the wonderful protests that have been happening in the country. And so yeah, I'm very happy, with how it turned out. I'm extremely happy that we had news outlets come and cover it. And
Yes.
I think that's great that happened as well.
So what are some key takeaways that you want others to gain from your protest and just currently what's going on? There's a lot of information being put out about race, how to educate your friends, your non-Black friends, how families can be educated who have no idea that there is any systemic racism going on. What are some of your advice for just people in general, or just things you want them to take away from just everything going on? So it's not just, a fad in this time period, but something that can really, everyone can take on and really try to impact a change.
Yeah, I hope that people take away, one, because, I am a healthcare professional. So I hope one of the biggest takeaways from this is that this, racism is definitely a healthcare issue. It's really an everything issue. But because I work in this field, I want to emphasize that it is definitely a health related issue. And we see the effects of racism in all aspects and facets of medicine. And so I want people to really understand that it affects people in more ways than you can ever imagine. It affects Black people in more ways than we could ever think of. And so that's one thing. And I want people to really continue this discussion of racism. I think we really right now have the foot on the gas, we've never lived in a time, at least in our lifetime, this is the most time that we probably will ever live in, where everything is almost on pause, and we're really getting to see sort of the more ugliest parts of the country. And we can either do one of two things. We can turn a blind eye to it and keep it moving and try to get back to normal, or we can really examine and assess what's going on and do what we need to do to fix it and improve on it. Everything's real quiet because of the pandemic, and where we're not having all these extra distractions. So why not focus our attention on the things that really deserve our attention and have deserved our attention for years, but there was just always other things that were going on. So I would say anyone who is interested in tackling these sort of issues of racism and discrimination and microaggressions and inequities and all of those things, this is really the time to do it. I think there's a lot of leverage right now. I think institutions and programs and companies and organizations are all very interested.
I'm getting all the emails.
Everyone is very, Black Lives Matter. And so this is the time to sort of use that momentum and be like, hey, I'm demanding that we do this, or we need to do this, or we need to add this. This is time to use that to your advantage. And I would say strike now, while the pot is hot, and start really thinking about what you need to do in your own respective job or school or whatever the case may be. Really think about what you needed, what could be useful and beneficial as far as anti-racism lectures or curriculum or whatever it is, programming, initiatives, whatever it is. This is the time I think you'll get the most support for it. So do it, and don't be afraid, and be very unapologetic as you try to do it. So that, I hope that me putting on this protest, if that says anything, it says don't be afraid to do something. Don't put a limit on how big or impactful what you do may be, because you really never know until you do it and you see what happens. And just to go for it full force, especially with these topics. We need as many people talking about this and doing things in this arena as possible. So that's what I would say.
I like how you said to not be afraid, And I feel like that's a big factor and has been a big factor why this discussion hasn't happened to this degree, and I feel especially, I can even speak for myself, I recently posted something on Socialite about my own experiences. And for me, I remember discussing with you offline that it was hard. It was hard to put that into text and also share a part of my truth to, the public. And I feel like literally like what you just said, like now is the time, all those things that us as Black people have been experiencing, through educational system, through economic hardships, through, even workplaces, it's time to bring awareness to those issues. And everyone needs to learn, everyone needs to learn and really take an open ear to hearing. And also, it can be tough, but also being open to sharing. And I know it's hard to want to continuously educate people, but we definitely all need to figure out ways that we can contribute and work together and, really make that big impact. So, thank you for sharing your experiences and not being afraid and unapologetic. And what dripping Black girl magic all over the streets. Because it wasn't something to take lightly or light what you did. It was definitely a big impact on so many people, and great to see, some colleague in the professional world doing something so grand scheme. So thank you for stepping out and doing that. And thank you also for taking time out of your busy schedule to meet with me.
Just kidding. No.
Okay, girl. But for taking time out of your busy schedule to talk to the socialites and just give your piece on everything going on. We really appreciate it.
Oh, of course. No, thank you for having me. Thank you for creating a platform to have people share these sort of things, and it's needed. It's definitely needed. It's definitely helpful. It's something that I, would have loved to see and get to be exposed to in my in moving in my journey. So just having something like this is super important, and so I'm glad you created that platform for people. So anytime you want to talk.
Thanks, girl. Well, this is the Socialite PT signing out with Dr. Evelyn Ashiofu. Bye, y'all.